It's funny, you would think, when you think of a medical library, you think, oh, especially a medical academic library, you have students and you have doctors. And that's true. I mean, that's most of the patrons that we have, but our patrons cover a wide spectrum, a wide array.
Even though it's specifically health, which seems narrow on the surface, it's so disparate within that category. So you've got students and faculty, you've got clinicians, you've got the public.
And the researchers are here. They're working 80 hours a week. I mean, and giving up their lives because it's what they want to do. And I really like being around people like that.
We get a lot of new students, some of them very excited and catch that electricity of when they walk in and it's all new and they're getting a new card.
It's very hard for me to not have a special place in my heart for the students, because even though I haven't gone through medical or nursing school or anything else like that, I have been a student a very long time, and I have some sympathy for some of the stress and the issues that they might be dealing with.
And so on one hand, yes, there are distinct differences between the medical students and the doctors and the residents and the PAs and the occupational therapists, but at the heart of things is just helping people find what they need.
Because people are here for so many different reasons we could never guess, and we don't know necessarily what their experiences are just by the questions that they ask.
People seek out information because they're trying to add meaning to their experience, whether it's their experience as a medical student, as a researcher, as whoever, whatever they are. And I feel that librarians are in the place to make that happen.
The number one thing that I try to get people to know about the library is that there are people here, librarians, library assistants, library technicians, student workers, who are here to help them. That we are friendly faces and that we're willing to help, that you don't have to be afraid to ask us for whatever it is you want. Let us know and we are here to help you. That's the biggest thing that I try to get across to people, is that there are people in the library whose primary goal in life is to help you.
I really enjoy watching people progress and learn how to effectively use and discover things through searching. And then ultimately, that's either incrementally or maybe in some cases a great leap forward, going to help them gain some kind of knowledge. And that's super rewarding.
And I feel like we're like the last stop before they go out into the world and become healthcare providers. And we need to make sure that they really feel comfortable with not just the technology now, but knowing that no matter what technology comes down the line, they understand how to assess and evaluate the information.
And so I like working with people who are here to help other people, who are here to help people get healthy, to find new cures for disease. It sounds trite, but there are people here finding the cure for cancer. And it's kind of a privilege to work with them.
There are so many pieces that have to come together for all of us to provide the services that are needed, not just for the students, but for the researchers and the clinicians. And I feel like every person here is just so service-oriented. They really want to help make a difference in for whatever the patron needs whenever they need it. And that is an amazing, amazing environment to work in. And I work with amazing people, and I feel very fortunate.
Well, I think part of the thing I like about working here too is the people who work here. I guess it's the best bunch of people I've ever worked with. So I feel very lucky that way.
Especially working with people who are so user-centered and user-focused has really helped shape my philosophy about what librarianship is and what service is. And so I know that whatever journey I continue on in terms of becoming a librarian, it will be the foundation will be here at OHSU and the OHSU Library.